I'm going to tell you the truth about dry eye disease. Do you ever have burning, scratchy, or even watery eyes? If so, you may have dry eyes. In many cases, these symptoms are overlooked and can cause mild to severe discomfort without treating this medical condition. Dry eye disease usually occurs when our eyes are not producing enough tears or are producing poor quality tears. Dry eye disease is more common than we think and could be affecting you. According to Dry Eye Directory website in May 2023, currently between 16.7 million and 50.2 million Americans have dry eyes. This is between 5 to 15% of the population. Informing people of how dry eye can present itself may improve the comfort and eye health of a growing population of people struggling with this common disease. Understanding the symptoms, primary causes, and treatments of dry eye disease will encourage the afflicted to seek help for the many ways they may be struggling with the dry eye. People who experience this variety of dry eye symptoms might experience stinging, burning, scratchy sensation when blinking, redness, sensitivity to light, blurred vision, eye fatigue, or even watery eyes. Many people often describe dry eye discomfort as feeling like they have something stuck in their eye. But if you experience watery eyes, you might be dumbfounded to find out the cause of their symptoms are from dry eye disease. After all, how could it be dry if your eyes are constantly wet? The answer to that is simpler than it initially sounds. The human tear film is made up of 3 parts: an outer oily lipid layer, the thickest watery aqueous layer in the middle, and the inner mucus layer as described by Sustain's website. The aqueous layer is the largest portion of your tear film, responsible for supplying the moisture your eyes need to be comfortable. If you have aqueous layer deficiency, your eyes don't produce enough of the watery component of tears, which makes it harder for your eyes to stay moist. This causes an overproduction of tears that do not properly protect the corneal surface. According to Florida Eye Specialist website in April 18, 2018, with blurred vision, itchy eyes, and irritation, dry eye syndrome is a common condition that affects most adults at least once in their life. While many sufferers experience dry eye because of the digital device viewing habits, the most common cause is a condition called keratoconjunctivitis sicca. This is a chronic problem where the tear ducts make a normal amount of tears, but these tears don't contain the right amount of water compared to the other chemicals in the mix. In other words, the tears are more concentrated than in normal healthy eyes, which can irritate the corneas and other part of the eye surface. This causes the eye to water even more, creating a symptom circle that's difficult to stop. To prevent damage to your cornea, it's important to treat the dry eye as soon as it's noticed. The Mayo Clinic website states that reasons for tear film dysfunction are many, including hormone changes, autoimmune diseases, inflamed eyelid glands, or allergic eye disease. For some people, the cause of dry eye is decreased tear production or increased tear evaporation. Increased digital device time usually causes decreased blinking, letting eyes dry out quicker. Certain medications can also cause dry eyes, including but not limited to over-the-counter antihistamines and many prescribed medications. Now let's discover the many options to treat dry eye. All right, Dry Eye Directory website, May 2023, suggests that dry eyes initially are treated by looking at a person's lifestyle and work routines. This might mean reducing airflow, increasing humidity, or tweaking the home or workplace. Other changes, such as identifying medication contributors and increasing supplements, example omega-3s, can help. Eye drops and eyelid cleansers can also improve the comfort of dry eyes. Prescription eye drops can help. And most first steps after seeing an eye doctor, over-the-counter lubricating eye drops are usually prescribed first before recommending any prescription eye drops. Informing listeners of dry eye disease will help raise awareness of this overlooked problem that many experience. If people knew more about dry eye disease, more people will be able to identify if they have it. Or if someone they know is struggling with it, once you can identify dry eye, you can start making changes to treat it and start your road to having a better quality of life and better eye health.